Hi everyone, I'm Mary Boo. I'm with the AdoptUSKids Family Support Team, and I'm delighted to welcome you today to Implementing Family Preservation Services for Adoptive and Guardianship Families, Lessons from the Field. And those lessons are going to come today from two great friends of the field, Adrian Owens of Georgia DFACS and Nathan Ross of FosterAdopt Connect, who are going to tell you about the programs that they operate that help keep adoptive and guardianship families together. So before we get started, I want to just talk a little bit about, again, for those of you who don't know about AdoptUSKids, we are a project of the Children's Bureau, and we offer a number of services. We have two primary goals. One is to raise public awareness about the need for foster and adoptive families for children in the public child welfare system. And we do that through, many of you will know the AdoptUSKids website or the AdoptUSKids ad campaign. You can't imagine the reward. We also, and this webinar is part of the second piece, we help states, territories, and tribes recruit, engage, develop, and support foster adoptive families. We at the Family Support Team, we do things like put on this webinar, share tip sheets and other resources for the field in this area. We have a capacity building and engagement team that also does webinars and works specifically with sites on helping them grow their recruitment and engagement and support aspects of their programs. We also have staff, the National Adoption and Foster Care Information Exchange System. We have staff who help prospective parents connect with their states, territories, or tribes so they can move forward in the process with foster care and adoption. We have also a minority professional leadership development in the adoption field, which is a wonderful program for leaders in the field from all around the country. And we're now in the, we just started a new cohort of those fellows. But if that's something you're interested in, let us know and we can share information, and that will be opening up again next year. And the other thing, of course, that AdoptUSKids well known for is our photo listing, which features about 5,000 children who are waiting to be adopted and more than 2,500 families who are home studied and are looking for children. So I'm going to turn off my webcam so you don't have to be distracted by me while we talk. But I did want to just have you see who you're hearing from today, and we'll keep talking to you. The goals of our webinar today is to share how systems can and have created or improved family preservation services for adoptive and guardianship families. And again, I want you to hear from those who are doing the work. So that's Nathan and Adrian, and we'll have a big chunk of time to hear from them and hear about their programs and what has happened in their communities. And then we want to discuss ways that you can ready your system to expand family preservation services if that's something you're interested in. And we'll talk about some tools we have and some things to think about as you move forward with creating programs to keep families together. I hope that all of you had a chance to take a look at a tip sheet that we just did on this topic. We're hoping to get deeper today in this webinar on some of the ideas that came out in this tip sheet. You would have gotten it today in an email from Britt Cloudsdale, who's also on this webinar with us and who does all of the work for the Family Support Team. It's also in the handouts panel of your GoToWebinar control panel if you want to download it now. I didn't do some of the housekeeping earlier. I should mention that this webinar will be about an hour and a half long. It is being recorded and will be posted on the AdoptUSKids Hub for Professionals as well as our YouTube channel. And it will, and you'll get a link to that. You'll also, there's a PDF of the slides in the in your handouts pod, and it'll also come to you in a follow-up email, which goes out about a week afterwards. And although you're muted during the session, we really hope you will participate. We really encourage you to use the questions pod to let us know if you have questions throughout. We'll definitely take some time after Nathan and Adrian talk where you can ask them questions, and we'll have time also at the end. But put them in as they come to you and we will get to them. And the final thing, and we have some polls and some other places where we hope to hear from you. So if you can participate, that will help this be a better session for all of us. And then finally, we ask that you evaluate the session at the end. You get an email from AdoptUSKids evaluation, and it takes just a few minutes, but those evaluations are really helpful to us as we move forward in planning different events. And Britt just posted a link to the tip sheet here, so if you didn't get it, you definitely can download it now. And we're going to start with we're going to do a few polls just to get us all on the same page of where we're at. So I hope you will participate. The first one is, who are you here representing today? Are you with a public agency, a private agency, an independent parent group association, or someone else? And if you can fill that out, we will take a look. Again, it helps us frame our conversation if we know who is in the room. And if you're answering other, you can feel free to type that in the questions pod as well, just so we can take a look at that. I'm going to go ahead and close the poll. I know not everyone has voted yet. And it looks like we have a largely public child welfare agencies, but also private child welfare agency, which again teams really nicely with, we have a representative from the public agency and a private agency with us speaking today. So that's really great to have both of those perspectives. All right, I'm going to move on to the next poll. Again, we all came here today to talk about family preservation services. How would you, in your state, tribe, or territory, rate the family preservation service for adoptive and guardianship families? And 5 being the highest. So if you think their services are excellent, do a 5. If they're somewhere in between, put there. All right, I'm going to go ahead and close this poll. And it looks like we have the perfect bell curve. So it looks like most people think the services are somewhere maybe average in the middle, and only just a few people think they're excellent. But I'm delighted to see that most people think they're at least mid-range and above. So that's pretty good news. All right, moving on to the next poll. And this is, do you track if children enter foster care come from a disrupted adoptive or guardianship family? So this is a question about, so how well do you know if the families are staying together and are being preserved? All right, I might go ahead and show you those results. So it looks like most people are tracking if children are entering foster care. So that is good to know. Again, important to know, so what those numbers are, because that'll tell you something about, as we just talked about how well your services are doing if you have a lot of children coming in from adoptive and guardianship families. And one final poll, so thank you for doing all of this. And this is sort of the same side, the same coin, which is, do you collect data on if adoption and guardianship placements remain permanent? And if so, how long do you follow families, or do you do any follow-up? And if you are doing this, I would love to have folks type in the questions panel what sorts of follow-up they do or how they're tracking this data. Let me go ahead and close this poll, and while I'm showing the results, so if any of you want to type in the questions panel, that would be great. So it looks like, again, not sure, but about almost a third of you are collecting data. So I'm hoping a couple of you will put in the questions pod how you're doing that. If anyone has anything to add about how they're collecting that data, I'd love to hear it, but I don't see anything in the questions pod at the moment. So we're going to come back to some of these questions, and I just see we already have. So anyway, we might come back to some of this data toward the end of the session, and so if you do know how you're tracking that data, we might come back to that and ask you to share that again. All right, thank you so much for that great participation. So I want to start with just a little bit of framing, again, that probably everyone is aware of. I just want to put it in context. As you know, the huge change in the child welfare field in the last couple of years was the passage of the Family First Prevention Services Act, which really brought a new highlight on family preservation. And we probably know it allows federal funding to be used on evidence-based services provided to families whose children are at risk of entering the child welfare system. And the definition of a child who's a candidate for foster care includes a child whose adoption or guardianship arrangement is at risk of a disruption or dissolution that would result in a foster care placement. So we know that children in adoption and guardianship are, could be covered under this, but we also know that right now there are no specific programs to adoption and guardianship that have been approved for the clearinghouse for that 4E funding through the Family Preservation Act. So it's a time where we're focused on family preservation. We know that adoptive and guardianship families have some higher risks for disruption, and yet we have no targeted things. So right now, we really, it's a great time for the field to build the evidence base of family preservation services designed specifically for adoptive and guardianship families. And what we know is that it's important to do that because we want to be funding and providing services that work, but we also want to build the evidence base. If we can get some of those services approved for the clearinghouse, that would allow more systems to access 4E funding and make them more accessible for other families. So it's certainly something that we as a field have to be thinking about and focused on, even if we don't yet have specific programs that can be eligible for that 4E funding. So again, as we talk about family preservation services, which everyone offers, that we know they work best when they're responsive to the specific needs of the families they're serving. And we also know that adoptive and guardianship families have unique needs that aren't necessarily the same as other families being served by family preservation programs. In many cases, the challenges are based on the trauma, grief, or loss the child has experienced, and the family's inability to respond with effective parenting, given that trauma or loss background. That can be somewhat different than what's facing other families. We also know that providers need to be adoption and permanency competent and be well versed in the core issues of adoption, grief, and loss. And although traditional family preservation services should definitely be trauma informed, adopted and guardian families need their professionals to have a more comprehensive understanding of trauma caused by removal from the family and the foster care system themselves. So again, these are children who've already experienced at least one and often many more disruptions in their family life, and that just creates different dynamics than other families may be facing. So for this reason, traditional family preservation services may not be the best fit for adoptive and guardianship families, and would likely be better served through targeted preservation services specifically designed to meet their needs. And that's one of the things we're going to be talking about today, these programs that are very specific to adoptive and guardianship families, although one of them also serves other families as well. So again, the two programs I keep alluding to, we have the crisis intervention teams from the Georgia DFACs, and we have the behavioral intervention model from FosterAdopt Connect. And I'm super excited and grateful to have Adrian and Nathan to talk about their programs today. There are two different approaches to adoptive and guardianship preservation, which I think is really important to know. There's not necessarily one size fits all, but there are a number of ways to improve services to keep families together. As I mentioned earlier, one of the things that's also great is you get to hear from Adrian at Georgia, who's a state administrator, and Nathan, who's the private providers administrator. So you're getting recommendations, challenges, and ideas from both the funder and the vendor side of the equation. And again, we'll talk a little bit after Adrian and Nathan have time to share their programs. We'll talk about a couple other ideas that are in the field as well. So now let's get started with the heart of what we're here to hear about today. And I'm gonna, just again, a reminder to you that if you have questions, please type them as you go, and we'll have time after we hear from both Adrian and Nathan to get to your questions. So I'm going to start by welcoming Adrian Owens, who's employed with the Georgia Department of Human Services. He's the Social Services Administration Unit Director, and the Social Services Administration Unit provides management and oversight of the financial resources for the Title IV Adoption Assistance Program, post-adoption services contracts, policy development, interstate, Medicaid, training, field consultation, records management, and regional quality assurance and compliance auditing. Just a little job description there. So I want to welcome Adrian and invite him. I'm going to ask some specific questions, but I want to start out by just asking Adrian to tell us a little bit about the Crisis Intervention Team program.
Yes, well, Mary, first of all, thank you for having me. It's a pleasure to, work with you as we have over the years, and definitely a pleasure to be here to share, some of the great work we're doing in Georgia. Our crisis intervention program is one of our most popular post-adoption services programs that we have in Georgia, and it pretty much operates on a 72-hour crisis response team where we have short-term intensive services, including in-home crisis response, behavioral therapy, and other service navigations for our families. Referrals to ongoing supports are also provided at the end of the time period in which the team will work with the family to kind of help them move on and seek other supports and improve overall family functioning for the long term. To be eligible, we are supporting families who are receiving state-funded and Title IV adoption assistance, as well as guardianship assistance, is pretty much the eligibility criteria for this program. And it runs generally from 60 to 90 days, where the team will work with the family. One of the things that makes this program so very popular in Georgia is that the crisis intervention team actually travels to the family's home. So with most of our cases residing in the metro Atlanta area, it really cuts down on a lot of traffic. There's a large traffic pool here in Georgia that can sometimes makes it difficult to get around. So that's a very popular aspect of the program as well.
Great, thank you. Okay, and I'll get into some specific questions here. First, is just how did the program get started? How was it designed? Who came up with it? How did you launch it?
Well, basically, the program's been around for close to about 20 years now. In Georgia, the adoptions program for a long time has kind of been operating on a separate budget. At the time, back in the late 90s, early 2000s, as the Office of Adoptions in Georgia was being created, we were looking to build up our service array. And just like many of our other services, we put out an RFP to solicit these types of services. So what we were able to do was, meet with a lot of different vendors and kind of narrow down who we felt would be able to best do this program. So once a vendor was selected, we then began to work on fine-tuning the program and ensuring that we had a statewide model to keep up with our statewide adoption practices. So that's pretty much how the program was designed. Your basic old, government contracting, RFP bidding process is how it came about. But prior to that, obviously, the Office of Adoptions, we had a need in terms of what we wanted, which was, a program that would assist our adoptive families and, work with keeping families together in adoptions and preventing children from having to re-enter foster care was our main, was our primary goal with this, with the design of this program.
Did you have, was there a needs assessment, or were you seeing disruptions, or like what made you think, oh, we need to add crisis services to it? Because obviously lots of post-adoption programs don't have a crisis model. Was there something, was there data or requests from families, or what was the emphasis?
Well, it was a little of both. It was, information that we received, information and feedback that we received from families on, what they felt would be helpful to keep kids in the home, as well as, our data. I think, just like Georgia, just like all states, we're always constantly working to, reduce any type of reentry rates into care. So I would say a little bit of both, and that's kind of what prompted our need for a crisis intervention program.
Great. And then the million-dollar question everyone asks. So how did you fund it? So you knew you had a need. How did you, find startup funding, and how have you been able to sustain that funding for 20 years now?
Yes, funding is always a million-dollar question. In Georgia, we're a little bit, we're pretty unique in that our adoptions program, we have a standalone budget. Our budget is separate, is legislatively separate from our foster care budget. I know it's not like that in a lot of states, but back in the late 90s, early 2000s, at the time, our governor in the state of Georgia was really, really interested in adoptions and paved the way for us to have our own separate budget. And with that came, monies and funding and resources for us to put together our pre and our post-adoption services programs. And what we've been able to do over the years, since that legislation has not changed, we've been able to, over the years, know and pretty much know what kind of funding we were going to have year in, year out. And with that, it allows us to continue to have vendors, help us with this work, because we know that we're going to have funding each and every year. Now, obviously, part of our job is to make sure that we're, utilizing funding in the most appropriate way. But the good thing about that, Mary, is that the adoptions program in Georgia, we do not have to compete with, other programs, under the foster care umbrella. We know what we're going to have each year, and it makes it really easy for us to kind of zero in on what types of services we want to provide. And it also makes it very easy for us to continue relationships with vendors who provide these services. So, yes, that is the $1 million question. We also just carried a little bit further about funding. We utilize, federal funds. We also use state funds. So with a lot of our vendors, we are using a mix of funding streams to provide services for our adoptive families. So that's one of the things that makes it, our situation in Georgia pretty unique. And it's really been helpful over the years where we've been able to sustain these services for, decades. So I'm very happy for that.
Great. So in terms of the federal funding, are you using like adoption incentives or the D-Link fostering connections, or what types of federal funds have you been able to apply to this program?
Yes, good question. We're in Georgia, we're using a mix of all of those funds that you mentioned. We're using a lot of promoting safe and stable families funding. We're using a lot of adoption incentive funding. We're also, like you mentioned, we're using D-Link funding as well as a small portion of our state of Georgia funding. So with all, all those different types of funding streams, it makes it possible for us to continue providing these programs, each year for our adoptive families. And one thing I will say also in Georgia, our caseloads are continuing to grow. And, that's a testament to, the good work that's being done in Georgia. So we're always, trying to stay in the forefront of ensuring that, we are creative with our funding, and we ensure that, we can do the best that we can for our growing number of families here in Georgia. So that's kind of how we use our funding.
Great, thank you. Okay, let's talk a little bit about staffing. So can you tell me what qualifications the staff have, and what type of work they do?
Yeah, absolutely. Our staff with the crisis intervention team, they are master's level team leaders as well as bachelor level employees that works along with them. But basically, the crisis intervention program in Georgia is broken up into 4 service program areas that covers the entire state of Georgia. For anyone out there that may not be familiar, Georgia has 159 counties. So we have a lot of counties, a lot more than other states. And albeit a lot of these counties are small, when you're talking about, State Department of Family and Children's Services, our programs are, they operate statewide. So we have this program. We have 4 hubs. We have one in Augusta, Georgia. We have one in Macon, Georgia. We have one in Atlanta. We also have one in Savannah. So with those hubs being spread out across the state, the crisis team is able to kind of check into the hubs, and that way they're able to meet family needs all across the state. What happens is that, once a referral is approved, I will sign off on the referral, approving it. We get it to our vendor. Our vendor will then assign it to one of these offices that I mentioned, and then assign a team to actually go out and begin working with the family. Basically, the management team consists of a regional team leader, a program supervisor, an area director, as well as a state director. And the state director and the area directors, they're more, administrative, ensuring that, the staff have what they need. They also are the link between the vendor as well as us at the state office here at DFACS in Georgia. And that's pretty much how we work the teams. They have about 29 workers covering the state. Like I said, master's and bachelor's level, and they have also been trained in adoption competency. So, they are able to identify adoption issues that are, unique to adoptive families and adoptive children. So that's one of the things that we're really proud about, is that, we're able to send these teams out, but, at the same time, families are able to receive a high quality level of service related to adoptions.
And that, I think, segues right. Let me ask one more question before I segment. So in terms of staffing, you mentioned earlier that many or most of the families are in Atlanta. Can you talk a little bit about how staffing works in the rural areas? Because I know that for many states, that's there's just this huge disparity between what's available in rural and metro. But you still have in-home teams who can go anywhere. Rural areas, they just have to drive a little farther, or how does that work?
Absolutely. Our crisis intervention team, like I mentioned, they do operate statewide. Our regional offices, we have one in Atlanta, but we also have, like I mentioned, we have Savannah, Macon, and Augusta. And these are, larger towns, but they are, outside of Metro Atlanta. So by having our hubs strategically placed across the state, Atlanta to the north, Augusta, and Savannah to the south, and Macon in the center of the state, staff are able to, make it to families. We have families as far as the Georgia line or the Florida line. We have families, on the border in the South Carolina line. We also have families, way up north to the Tennessee line. So our families are able to be served by us strategically placing these hubs across the state, and not just in Atlanta. So yes, we have an Atlanta office, but we also strategically place the other 3 offices so that coverage can be provided to the entire state. Because, when we're making adoptive placements, we do not, a lot of our placements are in Metro Atlanta. However, we don't stop there. Anytime we can make a placement and we have a family and a child that's a great fit, we are able to go ahead and make that placement, as well as, feel sure that we have service provision that can reach them irregardless of where they may be in the state.
Great, thank you. So you started talking about this, and I wanted to go back to that rural question before going on. So you talked about doing adoption competency training. Can you say a little bit more about how you do that training? And then are there other things that make these services tailored to fit adoptive and guardianship families specifically?
Yes. Regarding the adoption competency training, yes, that is a requirement that we, as the state of Georgia, that we put in place for our vendors, just so that, we know that, we are, our families are experiencing a high level of quality service that is, well-versed in the adoption arena. I think sometimes, in this work, we see where, families are receiving services, but sometimes, the services may not, always address the issue. So I think it's important that, we're, mindful of, who we are sending to our adoptive home. So that was, the primary reason why we wanted to, access the adoption competency training. It's a national model, so we felt really good about that. Also, when it comes to, tailoring the services to the family, the crisis intervention programs, they provide crisis intervention strategies to help maintain and preserve adoptive placements. So, staff are trained not only in adoption competency, but they're also familiar with all the specialized traumas and experiences that, adoptive children and adoptive families will face at one point or another throughout the adoption. So we are happy that, our team here with the crisis intervention program are, well-versed in a number of areas related to adoption trauma.
Great, thank you. All right, move on to the next question, which is, of course, the question we're already getting some questions on this. And so can you talk a little bit about how you evaluate the program? And then we'll ask you to talk a little bit about what kind of outcomes you've experienced.
Yes, we we evaluate the program in a number of different ways. When it comes to the actual service provision, the crisis intervention team, we use the CANS trauma assessment as well as the CLIO assessment, and that's used at the beginning of the service. And we want to provide an initial baseline of behaviors and assist with kind of tracking the progress of the child throughout the duration of the service. At the conclusion of this, a satisfaction survey is provided to the family, and during the satisfaction survey, they're able to highlight any concerns, provide any feedback, both positive and negative, in terms of how the service served their family, and just talk about any kind of attributes to the program. In turn, myself, at the state level as well as our vendor, we're able to meet several times throughout the year to kind of work through those and ensure that we can correct anything or improve on anything. And it's always good to just kind of hear what the feedback is, whether the feedback is positive, whether the feedback may be something that we can use as a learning opportunity. It's good either way, and I think it helps us to continue with providing a nice high quality product through the crisis intervention program. We also have the regional team leader who administers internal tracking and discharge forms that capture, the positive and the negative and the neutral outcomes of the service. So that's a really good one. We have the crisis team. They, like I mentioned earlier, they conduct quarterly meetings with their stakeholders, and not only ourselves at the state office, who are, obviously, the keepers of the contract, but also stakeholders in the community. And a lot of that is, our county staff, as well as our adoption stakeholders in the community with some of the other private agencies. The program supervisor with the crisis intervention team, as well as the regional team leader, they also conduct, regular monthly staff meetings where case consultations and case discussions are discussed and administered, along with any other programmatic updates for the program. The regional supervisors also work very hard to provide training recommendations for their staff. They also do a really good job about hosting their own trainings internally through their agency. They will also reach out to us at our state office to, check in with us to see if, we would like to suggest any trainings, and always keep us abreast on what trainings that the crisis team are being provided. They also offer a variety of trainings through their company portal. They call it the Mentor Network University. And it's a really neat program where, staff can kind of go on the portal and make sure that they're always up to date on some of their annual trainings that way. So these are some good ways that they're able to keep their staff trained and abreast of a lot of the newer techniques that will be needed when it comes to working with our adoptive families. Again, like I mentioned earlier, we also partnered with Georgia State University to offer the training adoption competency program that we have the team leaders signed up in there. Also, we provide a community resource guide that's included but not limited to, other specialized therapeutic services, intensive family interventions, support groups for adoptive parents, and other, webinars, training videos, and educational videos and literary materials. So those are some of the ways that, we're able to evaluate, the effectiveness of the program. We also use, some internal data that we're able to pull, from our, from our SACWA system as well. But a lot of our, evaluation of the program comes from, meeting with our vendor and working through information and data that they've obtained from families that they've worked with. One of the things that I really like, Mary, is the client satisfaction surveys, in that, we're able to, as state level administrators, we're able to, review comments and feedback directly from the families. It's not feedback that, someone, from the program is giving us, but real honest feedback, from parents. So that always goes a long way in helping us evaluate the effectiveness of the program.
Great, and it's always love to hear when you can incorporate feedback from parents and young people into how you change the program. Let's talk a little bit about outcomes. So do you have any outcomes you can share, whether it's, and I know somebody's asking specifically about how you're using the CANS assessment. Do you look at, our behaviors, internalizing, externalizing behaviors better after treatment? Do you have fewer, people are also asking you, hey, have you seen a reduction in re-entry into foster care? So can you talk about some of the outcomes?
Yes. We use both the CANS and the CLIO, depending on the situation. Given that this is a crisis intervention program, I mean, no two families will have the exact same crisis. So, kind of depending on what the circumstance is, kind of drives how we use the assessment tools. But basically, we are always looking to have an ability to track a family's progress in using these tools and using these strategies that we use to work with families in crisis. Oftentimes, a big part of it is really just stabilizing things, and overall family functioning in the home. Once we can kind of stabilize, then our therapists can kind of get in and start to peel back layers of different types of traumas, and make assessments from there. And they're able to kind of hone in on ways to help help our families and help our children improve overall family functioning. So it's I think the big thing with this program is that it is every crisis with families, it looks different. So when it comes to outcomes, yes, our disruption and dissolution rate in Georgia is very low. We do, unfortunately, like all states, we have some children come back into care, but we are constantly working to provide families with the supports they need so that children can return to their adoptive home and not have to return to care. Also with this crisis program, we've had families who may have had to use the program a number of times. It's not a I don't want the audience to think that it's a one-time only type of a program. It is a short term, 60 to 90 days. Sometimes we're able to do waivers to keep the team in the home a little bit longer, but eventually we will discharge the family and refer them out to other community services. And a lot of that is, therapy, ongoing therapy for the child. Sometimes it's family therapy. It's just going to look a little bit different based on, what the family issues are for whatever their crisis or their trauma is. With the outcomes and disruptions rate, sometimes that can be a little bit tricky in terms of data. But in Georgia, our rate is very low. I mean, we have in the last year and a half, we've seen a lot more children return to care, and a lot of it's due to a lack of mental health needs in Georgia. We're definitely working to improve that, but that's our primary reason around children returning to care. It's just sometimes the needs are greater than the average family may be able to handle. But with those cases, we are always working on alternative funding to maybe cover cost of residential treatment facilities. We also have the ability to utilize specialized funding to maybe help with special therapies or special testing. And we do all of that, in an effort to preserve and keep that adoptive family together.
Great. All right. And then just sort of on your final slide, and then just to let you know, we have some specific questions for you. So we're going to ask you this question, but then we'll do a couple questions for you before moving on to Nathan. What recommendations do you have for others? How are there challenges you've overcome? If someone was looking to put in this model, what should they be thinking about, or what can you recommend to them?
Well, I think the most important thing is, however you decide to do it, secure funding. These programs are not, they're not built overnight. They take a number of years to, kind of go through some ups and downs to become very, very effective. So my number one item for administrators would be to secure funding. Ensure that you can secure funding year in, year out, so that you have the ability to build a program over the course of, several years, whether it's, 10 years, 20 years, but you want to have a program and you want to have a vendor that's in place and that's solid and that knows, your clientele, that knows your audience. And, with that, you get really good quality service. It becomes difficult when you have vendors, kind of coming and going all the time, and it just doesn't allow, families nor vendors an ability to really become comfortable with each other. So I would say that's kind of the number one thing. And again, I mean, we've been very fortunate enough in Georgia to have that budget, legislatively protected in the adoptions program, and that's something that we really are thankful for. So, however, administrators are able to do that, not saying that they have to, have their budget legislatively protected like we are in Georgia, but however, just ensure that you have a solid funding stream where you can, work with vendors year in and year out. I'd also say, make sure that your programs can work, statewide. One of the big things, that you even mentioned earlier, Mary, was that, sometimes when it comes to rural families, oftentimes, service provision in rural areas can become challenging. And families, unfortunately, in rural areas have to suffer. So, you want to make sure that you have a solid vendor who can definitely meet the needs of your family statewide. Also, make sure that you have, make sure that the vendor has enough employees to, reach and meet the needs of your families. Generally, at the state level, we deal with a lot of families that come through our public system for adoption, and oftentimes, the numbers can sometimes far out, outweigh the staff. But you have to make sure that you have these programs staffed adequately so that you're able to meet the needs of all families, both in your metro areas as well as your rural areas. And also, have a really good solid system for documenting and record keeping. I think that's something that is always helpful, and obviously in this line of work definitely needed, so that you can document and track your efforts. Again, that kind of helps us when it comes to soliciting feedback, as well as determining how well our services are going, and how we may want to evaluate our services to tweak them or improve them down the line. So definitely a good record keeping system. And again, always additional any kind of additional funding that states or agencies can secure will always help either strengthen your programs, or even add services if you need them. But funding always helps the cause.
Yeah. Okay, speaking of that, so we have a couple questions that I'm going to ask, but we got to go quick. One is, do you use the Medicaid funding for this program?
No, not as of this point, not yet. But that is something that we have kind of began to scratch the surface on. Like I mentioned, right now, we cover the cost of these referrals through through a contract, which is funded through federal and state dollars. So that's how we're currently covering the cost of the program for families that may want to access crisis intervention. Great. But we are looking at using Medicaid.
Okay. Yeah, it seems like that's a good option for folks in many cases. So the other question came a couple times, as you mentioned the resource guides. Who creates those, and how do they keep them up to date with what's really happening in each of the communities you serve?
The resource guides are created by both. We have one that's created by our team at the state office. That's a DHS document, and we tweak that and keep that document up to date a couple times a year. We also have a resource document that our vendor puts together, and they're able to put that resource guide together, obviously with our sign off. So it's a, it's going to kind of look different depending on where, the families may live and what's available in the areas. But, the idea is that it's a, resources are all kind of, together in one place to prevent families from having to search around and, look around for services in their rural areas. So they're right there, in a handy, handbook all together. And it makes it, a lot easier for families. Keep in mind, these families are in crisis. So sometimes, they don't have the time to, maybe look around or do web searches or what have you. So we like to try to keep things all together.
Great. All right, I'm gonna ask one more question, and then we'll, again, if folks have questions, we should have some more time at the end as well. But the last question is, would you be able to share anything with the audience, for example, your satisfaction survey or your resource guides, or those things that you would share with others?
I can check into that, Mary, and let you know. Yeah, we should be able to share that with you guys. And it kind of is, a real straightforward client satisfaction model. It gives, questions. Now, obviously, these can be kind of tweaked for program, but for different programs and depending on what it is you're trying to capture. But yes, it's something we can share.
Great. Thank you. Thank you, Adrian, so much. It's always good to hear from you, and we're going to move on to Nathan now, and then again, we'll come back if folks have other questions. So thank you, Adrian.
Thank you.
And now I'm delighted to introduce Nathan Ross, who's the Vice President of Children and Youth Programs at FosterAdopt Connect and is an alumnus of the foster care system. He oversees the development, implementation, and execution of programming intended to directly serve children and youth affected by the child welfare system across all of FosterAdopt Connect's branches. And so Nathan, welcome. And can you just get us started by telling us a little bit about the behavioral intervention program?
Yep, absolutely. And everyone can hear me fine, I hope?
Yep, you sound good to me.
Okay, cool. So the Behavioral Interventionist Program, or BI, as I'll probably refer to it moving forward, is a program that works to provide in-home support for children that have behavioral reactions as a result of the trauma that they endured prior to coming into foster care or into an adoptive placement. So that program was developed in response to a need for a family within our community, within our organization, and has been developed over the last 6 or 7 years to meet that specific need.
Great. Can you talk a little bit about what the services look like? Sort of what types of, I know there's in-home services. And I also, I think you serve all types of families, started with adoptive, but also foster and birth families as well. Is that right?
Yeah. So our program works with anyone connected to the child welfare system. So primarily, we work mostly with adopted and foster parents, although as our organization has expanded some of our work, we've begun working with birth families in order to prevent children from coming into care. We also work with guardian providers, kinship providers, especially those who have informal placement of children in order to prevent children from coming into care unnecessarily. And so the BI model, again, it's intensive and it's one-on-one. So you have a behavioral interventionist or a BI who is staffed to work with that family. So they go into a family's home after an assessment is conducted by one of our coordinators, and a behavioral plan is created. And that behavioral plan works to, as you can see on the slide, the neurodevelopment pieces. So we're doing a lot of work to try to help address certain behaviors as a result of the neural pathways in children's brains. And so those behavioral plans, the BI works to do neural stimulation activities. And those activities range really anything that will help just change the functioning of the brain for kids. So it's simple things for children, tying your shoe or learning how to ride a bike. Also some de-escalation and coping skills. So those services are provided in the home, and the hours are determined for each family by the family's needs. And depending on the funding source, the funding provider might also have some input on the number of services and units that they're willing to pay for. So the BIs work in that home for as long as necessary, and then evaluation is done every 3 months. And with some of our assessments, those assessments are redone every 6 months. And we continue to modify the behavioral plan as needed until such a time where either the child can graduate from services or becomes a young adult and then transitions either into something else or no longer needs the services.
Great. And then tell me a little bit about how the BIs work with the parents or the caregivers.
Absolutely. The biggest thing that makes this program successful, especially when you have a stranger coming into a home and trying to provide advice for how to work with kids with behavioral needs, the biggest piece is that partnership is needed. So we do a lot of training for our BIs so that they understand that the parents still need to be the parents. They're still leading the ship, and we are providing a support service. And so the BIs, their general function is to back up mom and dad. One of the core pieces of the program that helps make it successful as well is understanding that parents, they want to and can care for their children. When children have lots of behavioral reactions as a result of trauma and parents are focused on dealing with those reactions on a day-to-day basis, it becomes hard to also do the loving, caring pieces that parents really want to do. And so our BIs come in and help alleviate some of that by taking on some of that hard work. And so they get to be the bad guy, the BIs get to be the bad guy and help redirect children and help de-escalate them so that parents are able to come in, utilize some of those skills, but also at the end of the day, get to tuck their kid in and provide the loving support and provide, reading them a bedtime story or any of the other things that they would be able to do with a traditional child or a child with very low behavioral reactions. So that BI is very much a partner to the parents while understanding that the parents take the lead. And then the parents also help inform the behavioral plan. So at any point in time, if something isn't working, they're able to tell us this isn't working and this is why. And so we have to make sure that our behavioral plans match what the family's capabilities are and that cultural piece for those families.
Great, thank you. All right, let's move into, you mentioned briefly that the program started based on the needs of one family in your community. Can you talk a little bit more about that and how from that need the program was designed and started?
Absolutely. So FosterAdopt Connect as an agency was one created, founded by foster and adoptive parents. And so part of it's really embedded into everything in the program mission is that the people affected by the foster care system inform program and policy for our organization. The behavioral program is no exception to that. So our founder and CEO had a child that was in residential treatment, two children that were in residential treatment, and both has very significant behavioral needs. And she found that she wasn't able to have the connection to them that she wanted, and they continued to actually digress, mostly because they were learning new behaviors from other children, but also the medications that they were on were making it so that they weren't functioning anywhere close to the children that she had remembered. And so after one specific visit with one of her children who passed out as a result of some of the medications, she took the child home and wanted to do something different. And so removed them from residential, but also understood that the components that the staff provided was going to be necessary for this child to maintain in her home. So she went through the work of working with the state to develop a model. And because it was for, her child to pilot, it was not one that we could bring on to our agency. So she also found a community partner who did therapeutic work and gave them the model and began having it funded and working with this child and her family. And then other families found out about it, and the program grew so big that the organization that she had partnered with said, you've got to do something. We, are a small mom and pop organization. We don't have the capacity or desire to make this into a big thing. So several years ago, we tailored that program, added some additional components in, and then brought a bulk of it into our organization, excluding those from her family and some of the other families who were already receiving services. So the program was very much developed because a foster adoptive parent saw the need and was able to work with our community and our state to get something developed. It was absolutely acknowledging that there are pieces within residential treatment and congregate care that do help children, but also acknowledging that kids should not grow up in that setting. It does not provide them with that parent, that loving support of a family. And so we had to find a way of getting both for children. And this program is a result of that.
That is a great partnership. I love that. So talking about that, so how was funding secured, I think, and from the state, and how has it grown ongoing with funding?
Yes, so initially a big chunk of the funding, and I'll talk from our organization standpoint by the time that we brought it in-house. So when we first developed the program and brought it to FosterAdopt Connect, a large part of it was funded through grant systems. And so we wrote a couple of grants for the BI program. It had one staff person, and this one staff person was everything. She was the manager, she was the coordinator, she worked with the families, did the assessments, hired the BIs. And the rate of service that we billed for at that time was half of what we bill for at this point in time. And so, but we needed to get it started. We needed to show that it was a program that was going to be utilized and that was going to be effective. So we had some grant funding, and we, on case-by-case basis, could get adoption subsidies to pay for the service if children were adopted. And there was some funding that we could use for foster kids, but by and large, we were using grant funding to help show the efficacy of the program. And as it increased in popularity and the results of kids coming out of residential and staying with their families, we were able to work with the state to bring in a consulting group who did a study of the program, the rate, and compared it to rates of services for other programs. And that's what got us to the rate that we have today for Missouri. And then we were able to get that put into the state budget. So because of our partnership with the child welfare system in Missouri, specifically in Kansas City, where our headquarters is, we were able to get that put into the state budget. And now that's one of our primary sources of funding. Additionally, we were able to tap into some federal funding within the last 3 years for Victims of Crime Act VOCA funding that allowed us to serve kids who weren't being served by adoption subsidy funds. So that gave us our foster children and some of our kids in birth family situations, although has some gray area there. So between our VOCA funding and our child welfare funding, that funds 90% of the program. We still have some grant funding that we utilize and that we write for specifically for birth families. Again, that in between, especially those who don't have a formal child welfare connection.
Weren't you also able to access Medicaid funding for the program at one point?
We don't have Medicaid funding for this program, and that's one of the things that we are working on right now. And so we have branches in 5 locations. Our Kansas branch works with a private agency, and they pay us directly, but they get reimbursed through Medicaid, but that's something that we're excluded from. So we are working on becoming Medicaid eligible ourselves so that we can draw down those dollars. But states are able to, if they want to, utilize that funding source as a method of paying for this service.
Great. I think that's, as folks asked about the Georgia program, I knew it would come up here too.
Yeah.
All right. Then the next question is sort of the big one, and somebody has already asked this. So what is a BI? What is the staff? What are their qualifications? How do you staff it? What does that look like? Absolutely.
So this has been one of the biggest growth pieces of the program since its inception. So as I said, when it first started, it was one person. She managed, coordinated, worked, and did everything, and then hired BIs. And those were staff with college degrees who went into homes and worked with the children one-on-one and partnered with the families. We quickly learned that that was ineffective for providing the level of services that we needed and to meet the needs of our community, because we receive referrals every day, multiple referrals for the service. And so as a one-person show, to manage 50 staff and 50 cases was impossible. So we then moved to a coordinator position where we had coordinators who worked with family and then coordinators who work with BIs. And that was our most recent change. We actually did that last year. And so we divided out the workload. The caseloads are still fairly high, but it works. It seems to be working for our staff at this point. So we have a program director in 2 locations, and in three of the locations where the BI services are, we have coordinators. And so there's a family coordinator, and that person does the case management. So they meet with the families, complete the assessments, identify that behavioral plan. They work with the state, the child welfare worker, to get the service approved. And so they do all that, the liaison work and monitoring case progress. And then we have a BI coordinator, and that person is responsible for hiring staff, training staff, providing supervision, and that kind of support. We also added a quality assurance piece because there are lots of assessments, there's lots of billing, there's lots of things we need in order to make sure that the program is functioning. There's shift notes that have to be written. We made a decision to write our shift notes with Medicaid compliance, so that when we became Medicaid compliant or were able to draw down that service, we wouldn't have to reteach people how to write their communication logs. So we have a check for that, check and balance for that system. So the salaried staff are all coordinator staff. And then our hourly staff are the behavioral interventionists. And so those are part-time positions. And again, when we first started the program, those were people with bachelor's or master's level degrees who wanted to, either they were just out of college and wanted to get an idea of behavioral health and working with kids in foster care, or they had some other personal reason why they wanted a part-time job. What we found is that's great, and we love that we have people with the education. However, there isn't really a degree that prepares you to be a behavioral interventionist, because that work is de-escalating kids specifically who have behavioral needs, and that it can include restraints. And so we were training a lot of our staff, and we weren't keeping people. It's a part-time position, and someone that goes to college for 4 years does not typically want a full career of working nights and weekends at 25 to 30 hours a week. So at the end of last year, we worked with our child welfare system and said, we want to do something additional. We want to keep the idea of having degreed staff. We see the value in it. We see the value of that education, but we also want to create our own way of training staff. We want to create a curriculum, and this curriculum will train them on all the things we've learned about how to be a BI in the 7 years that we've had this program. So we used our coordinators' knowledge, all of us with all of our infinite degrees, and developed a curriculum. And then we got that curriculum approved by the state. And so it's functionally approved right now, especially as it relates to COVID and all of the difference in our world because of that. And so staff now go through a curriculum training, which is in total is about 4 days worth of intensive training, and it doesn't require the degree. And so while we still look for that degree person, we're also providing an intensive shock to our non-degree people who might have child welfare experience. Say they worked in congregate care as an hourly staff person without that degree requirement, so they have some experience but without the degree. And we're providing them that knowledge so that they're able to go into homes and provide the same effective service as our degreed BIs, and we were able to widen that pool. So that's who staffs it now. We have degreed and non-degreed people, but they're all trained on a curriculum that's been approved by the state and developed by us.
Great.
And then I see how the services are tailored. It really is. The families sit down with us at the assessment process. And so we go through and we ask them, how does your family function at this point in time? What would you like it to look like? How does your child interact with family members? What would you like that to look like? And we have several evidence-based assessments that we use, and we use all of that information to come up with that behavioral plan. And then everyone who's on that team signs off on it, including the parents. So once everyone's agreed that this is the plan that we want to use, that's what the BI then implements, and we modify as we need to, depending on how either the BI is informing us or the parents are informing us.
And do you check in on that plan? Like, is a certain amount of time that after 30 days, or how does it work? Like, what's the check-in process?
Yeah, the formal check-in for it's called an individual behavioral plan, behavioral objective. plan, or IBOP, and we check on it formally every 3 months. And so the family coordinators are checking in with the family every month to see how are things going. Do we need to make any adjustments? The BIs are checking in with their staff daily, but at least formally during formal supervision, at least once a month to see, do we need to make changes? We're also reading shift notes. We're reading for incident reports. If we have a critical incident, like one that results in some kind of behavioral hold or crisis hold, we look to see if the behavioral plan is functional. But at least every 3 months, we're looking at it and making changes if necessary. And then the IBOP, the Individualized Behavioral Objective Plan, has to be redone once a year. So if for some reason we've gone through a year and we haven't changed that plan and nothing's come off, we at least have to do it once a year so that we are saying, okay, if we haven't made progress to check off anything, that means something didn't work. What do we need to do? How do we need to modify?
Great, thank you. People are going to ask some questions, but I'm going to hold them and get to this next part, which is always one of the key questions. How do you evaluate the program, and what kind of outcomes have you seen with it?
Sure. So we use a database system, and we had to migrate over. So I'm going to give you our stats as of 2019, even though the program has been there longer. And the clients served in 2019, many of them have been in the program much longer than that. So based on our 2019 stats, we served almost 200 kids last year. About 40% of those were adopted families, and about 40% were foster care families. And so that gives you our breakdown in general there. One of the pieces that's important to know that we use for evaluations is we're trying to prevent residential treatment or multiple residential treatment stays. So especially congregate care at all, but at least not having kids go back and forth. And so prior to coming into BI services, about 58% of the children who were served last year had been in residential treatment before they were in BI services. And about 51% of that 58 had been in residential treatment multiple times before coming into BI services. During BI services, however, 80% spent 0 days in residential treatment. And that covers children who've been in our program. I think we brought it to HQ, our organization, in 2015. And so we've had clients who are still in the program since then. And so about 80% have had no residential treatment stays, and about 10% outside of the 80, so an additional 10% only had one residential treatment stay in the time that they've been in the BI program. And then the other thing we are looking at is placement changes. We want to make sure that children aren't disrupting placements. That's a big piece. That family part is very important to us. And so for the same 200 children, almost 200 children that we've served in 2019, 83% of them had 0 placement changes in the time that they've been in the BI program, and about 10% have only had 1 placement change. And some of that varies. We get children in who are in foster placements, and the system has asked if they can start BI services prior to going to an adoptive placement to make sure that they are able to stabilize, and then we get into that adoptive placement home and help stabilize children. So that's some of that variance. And then the other pieces, we have assessments that we use, and I won't go through the specific details, but 2 of them that are really important are our Child and Adolescent Functioning Assessment, which is the CAFAS, and our Strengths and Difficulties Questionnaire, which is the SDQ. And so we use those assessments to show program improvement as well. And we're going through an evidence-based study right now for the Behavioral Interventionist Program. And I actually just received a report today from KU about it. And what they are showing is right now, based on all the kids that have been gone through that study in the last 2 years, we're showing statistically significant evidence that their scores are improving in the directions that they need to because of the Behavioral Interventionist Program. So we're really happy that I was very glad that came in as I was preparing for this presentation because it's helpful information. And it's one of those things where you believe that what you're doing is great work, and it's just nice to see objective evidence from someone who has no stake in it showing you that you're doing great work.
That's great. Yeah, and as I talked about earlier, what we really need to build that evidence base. So it's wonderful to be doing that. We are, of course, running out of time because you guys have such good information. So I'm going to ask you one quick question here, and then I have a couple questions for you. So finally, sort of what recommendations, as I asked Adrian, are there challenges or recommendations you would put forth to those interested in creating such a program?
Yeah, my two biggest recommendations, one, that community buy-in piece. We would not have been successful with this program without talking to our child welfare providers and our other community partners, because we didn't want to give the perception, again, that we are anti-congregate care totally. We understand its purpose and its function. And so we wanted to make sure that we had everyone on board. And so that took a lot of conversations and some tough conversations about how do we come in without stepping on toes. And so that's extremely important so that everyone knows what you're bringing to the table, and it helps you understand if what you're proposing is even necessary for your community. So that's an extremely important piece that has helped us to be successful. And then the other piece is that family tailored service is super important. And it ended up being one of our hiccups in the beginning, and sometimes a little bit now. And so the community wanted it, absolutely, but there was this perception that parents need to be held as responsible as their children. So we had a lot of perceptions, if mom or dad needed a break, a respite, and the BI stayed home with the child and worked on neurostimulating activities, that ruffled some feathers, and people did not like that. And so we had to do a lot of educating, and talking about, well, when I'm escalated, it probably isn't the best for me to stay in that situation. And so by allowing parents to take that break and then come back and talk through, okay, this is what we could do, or this is how it could work, we are helping to secure that placement for that child. And so we've had to do a lot of that education and make sure that we keep families at the forefront of our planning and our development for the program. So those are two really big pieces that I would recommend for anyone interested in implementing a model like this.
Great, thank you. Okay, let me ask you a couple questions, and then I have one more for Adrian, and then I'm going to talk for a bit, and if we have time, we'll see if we have other questions at the end. But so first, folks are asking if you would be able to share a behavioral plan, obviously a sample or an anonymized one, or the curriculum or the elements of the curriculum. Are those things that you would share with folks?
Yeah, I can share elements of anything. We're going through our own evidence-based study right now and replicating the program, so I would not be able to give the actual curriculum or the actual individualized behavioral plan, but we do like giving information, so we can tell you these are the components that you'll want to have and highlight those.
Great, that's very helpful. And then someone asked, and this question actually for both of you, so let me ask you this one and then I'll segue to Adrian. How do people find out about the program? Are there formal referrals? Do you advertise it? So how do people know this service is available?
That's a great question. So several ways. Anyone can refer to the behavioral interventionist program. A lot of our referrals come from either a child welfare worker, so whatever, I don't know what names those are in individual states. For us, it's Children's Division. So we get Children's Division referrals quite frequently, or foster and adoptive parents. But anybody can make the referral. We just have to have child welfare sign off if the kid is in care or if we're going to use adoption subsidy. And of course, the parents have to be willing and engaged in the service.
All right.
And for us,
yeah, so I would just thank Nathan for that. And again, we'll, if we have other questions, Dan, I'll try to get to them. But yeah, Adrian, if you can answer that question too. Thank you.
yes, and for us, Mary, families are made aware of the service at a couple points in time. One, when they're doing their adoptive or guardianship signing, they're provided with information on post-adoption services in which the information on the crisis intervention program is there. Also, our regional staff, our regional foster and adoptive staff, as well as our post-adoption staff, are all able to, make and submit referrals. So families are made aware of the program that way.
Great, thank you. And this is actually, I guess, sort of for both of you, although I think it was asked of Adrian, somebody wanting to make sure, is your program available only until finalization, or is it any time? And Nathan, the same question for you.
No, our program is available all the way, as long as they're receiving adoption subsidies or guardianship subsidies. So, that's on through age 18.
Okay.
Families can access crisis intervention.
And that's the same for us. We have some requests for children under the age of 6, and that's hard for us, and it's also hard for the state to get behind. But we have done that work, and we actually created a smaller version of the program to address that. But generally, 6 to 18, anyone can be served in the program.
Great. All right. Well, thank you both so much. I'm going to talk a little bit about a couple other models and some other things people should think about. And then if there are other questions, I'll try to get to them if we don't run out of time. But thank you both so much.
You're welcome.
All right. So again, folks, if you have more questions, we will we'll get to them if we can. So I just wanted to talk very quickly about a couple other programs that we think are really good. One is from the Seneca family of agencies. It's their permanency wraparound program. That's in California, serving a number of counties, and they create family-based teams with family members, community members, people who are important to the young person, care coordinators, and they go to the home and they do an assessment. They, work on in-home services, work on some of the specific unique needs of the family. They work on specific skill building, therapeutic assessment, and providing counseling services. They include peer support, just like Georgia Program Connection to other services. And that service is typically available for about 18 months. And their outcomes, they've been able to preserve 95% of the families they serve. And that's been going on for quite some time. And then I wanted to mention the Illinois Adoption and Guardianship Preservation Program. It has adoption and guardianship counselors who do in-home services. They respond within 24 hours, usually do an in-home assessment within 3 days. So they do an assessment, then they create a treatment plan with the family, and that includes peer therapeutic services, peer support, advocacy within the community for additional services. And one of the things that's notable about that program is, sort of as Adrian mentioned, the funding for Georgia, the adoption funding being in law. In Illinois, when the state created the Department of Children and Families, they identified preserving adoptive families as a part of the agency's role. And so they've always been able to have funding for it because of the way it was set up with that. That program has existed for quite some time and robust funding. So again, I just wanted to mention those quickly. Those are written up on the, you can find write-ups on those on the AdoptUSKids hub. And now I want to talk just a little bit about things to think about if you're wanting to create a new program. First and foremost is doing a needs assessment. And my emphasize Nathan talked about something, being parent driven, and Adrian talking about the program coming from data is so important. So another resource that we have at AdoptUSKids is a needs assessment that you can use with your foster, adoptive, and kinship families, and it talks about what challenges they're facing, what services they've accessed, what they haven't been able to access, what works. That can be really a helpful tool to use with your families to figure out what you need right now. And again, you can find that on the hub, or let us know and we will get you a link to that. Oh, there you go, Britt's giving you a link right as I'm talking. The next thing, of course, is looking at the data in your system. And again, I really appreciate that both of our speakers talked about this. So looking at displacement, disruption, and disillusion, what is happening? What are you talking to families when those things happen? Were there services that would have helped? What services are families using? Are you evaluating them both in terms of their satisfaction, but also outcomes and how things have changed? It's really important to be looking at data on what you're doing now before you create anything new, so you know what gaps you need to fill and what you need to address. And of course, again, back to what Nathan in particular emphasized, that what are families telling you they need? There's no one who knows better than the people who are living this day in and day out, what they think might make their situation better. I want to highlight a tool that we created at AdoptUSKids that we think is also part of creating a program like this, or any new program, is looking at what you're doing right now. We created the support services assessment tool, which I hope some of you had a chance to take a look at. But what it does is helps you, it's a tool, but it's also a guide to talk about the process. So again, if you want to know how well your supports are working for your adoptive guardianship families or other families, you want to bring together folks who are affected by those programs, so young people, caregivers, parents, workers, administrators, to come together to look at what you're offering now. And the tool looks at things in the along metrics of both quality and accessibility. And so when we think about accessibility, one of the things we talked a little bit about today is, rural communities. So you could have an amazing program in a metro area, but families in a rural community aren't able to access it. In terms of quality, you could have a great program, but maybe it's not culturally competent. And so this allows you to, we've created a bunch of different metrics you can look at, and you get input from your parents, from your providers, from your workers, and they can take a look and say, oh, look, and you end up with a chart like this one here down at the bottom, and it says, okay, maybe our advocacy program looks really good quality and really good accessibility. Oh, but respite needs some work. So again, this can be a great place to look at. And so if you have any services for the families with high needs, you could do an assessment on that. So what are you providing now, and what are folks telling you to, are you doing enough? So this is a great tool to work with. And if you need any help with it, we are also available to talk to you about how you can use that or other assessments. And again, I can't say this enough, probably do say it too much sometimes, but the one of, what you have to meaningfully engage parents, caregivers, and young people who have been affected this in any program design improvement needs assessment. So you have to think about, again, have you done a needs assessment? Have you talked to people about what they've been through, what worked for them, what didn't work for them? And again, don't forget to ask the young people, what do you wish your parents had known or had done differently? There can be an amazing learning from that piece of it that people don't do as often as we wish they would. And when you're engaging parents, caregivers, and youth, you want to really think about how to break down barriers, how to reach those who may not be as tech savvy, those, again, in rural communities, how to reach diverse communities. You have to think about making sure that you're getting representative sample. I know we often hear from the same parents over and over again, but are we reaching out to talk to those who may not have come forward to us, but may still be struggling or may have great feedback about what's working? And then when you do ask these questions, it's important to consider the power dynamics. Parents are, so many adoptive families, guardianship families, they were approved by the system. They are sometimes afraid to come back and say, I'm struggling, I need more help, and to be judged by the system that had once judged them and approved them able to serve. So you just got to think about that. And so maybe you have more parents engaged in it, or you partner with an agency that's not the state or tribal or territorial agency, might help you break down some of those barriers. And then the most important thing about engaging parents, caregivers, and youth is make sure you're going to use the information from them before you go get it. I think all of us have been part of, a survey or focus group where we have no idea what happens with what we say. And so always follow up and let people know sort of what the results of any needs assessment you did were and how you're going to move forward with it. I think if you want to continue to get that partnership from the people you serve, you need to be able to let them know how they're helping. I'm going to talk a little bit again about data, and I'm not going to revisit our earlier polls just because time is short. But I know we looked at, some of you knew that you were collecting data, others weren't sure. Critically important. And I think about this, I know Nathan talked a little bit about, they started out the program small and they basically did a pilot. I remember reading that it was 13 families. And then they had data from that talking about the reductions in out-of-home placements and are able to take that to build on it and say, look, this is a program that's making a difference. And so your data can be huge in terms of getting your funding and getting your sustainability. And I know Adrian also talked about that they really look at this regularly and make sure that they're doing what they want to accomplish. And they, talked about, okay, this year they may have seen higher rates of reentry. So you got to dig deeper into what's going on with that and how do we address some of that. So you always want to have a plan, both data up front about what the needs are, but also data about what you're doing and how you're serving families. I think we are gonna, in terms of things you collect on data, things to think about is, I know Adrian talked about that client satisfaction. We talked about the different assessments. There are other data you might collect is pre and post service surveys on stress and well-being. tracking family stability is incredibly important. Or as Nathan talked about, length or number of times in out-of-home care are some of the data elements you want to be looking at. Anyway, so I want to notice that Britt shared a comment with everyone that really important about checking in with your families yearly for an update on their circumstances. And I know some states do that for anyone who gets a subsidy and some don't. But I think it's a great idea. Any communication you can have with your families is really important. I wanted to ask, somebody brought it up earlier, and I think we can't in this time go without asking. I wanted to ask both Adrian and Nathan about COVID and how that has affected the services they provided and how they've been able to handle that. I just think you can't, in this moment in time, ignore that. And somebody asked, and I wanted to ask that. So Nathan, can you talk first about how you've been able to handle services during COVID?
Absolutely. And COVID has been a very, very big struggle for us more recently than even in the beginning. In the beginning, we were fine, and we actually saw an increase in BIs and in hiring because, unfortunately, many people were laid off from jobs and pieces like that, but we're still willing to go into homes. But as the number of people who've been sick because of COVID has increased, that has specifically and significantly affected our clients. And we've even had many clients close because they couldn't afford to take the risk of having strangers come into their home because of the risk of COVID and having children or other family members with high risk conditions. So we've struggled. I get probably 3 emails a day of new staff who are on leave or who are quarantining because of that. So we are seeing some significant barriers just because it's a big deal, and you can't have people in homes when they're worried about being sick. So we're trying to figure out the best way to do that, to keep families engaged and to keep our staff safe. We, of course, have all the protective gear and pieces like that, but you can't guarantee that for everyone that they come in contact with.
Right. Yeah. Adrian, any specific things with your program to address during COVID times?
Yeah, well, with relation to COVID, we have continued to provide crisis intervention services the best we can. But, pretty much like Nathan, we've had to have staff, utilize virtual technology to still, be able to make contact with families when, our staff or our families are being concerned about COVID. When they are able to actually make physical visits, then, they are using PPE equipment. But at the onset of COVID in early March, we had a lot of our crisis referrals actually slow down until I think, we could kind of figure out the best way to kind of still be able to provide, services for families. I think with COVID, it kind of caught, our entire nation off guard. So it was one of those things, Mary, we had to kind of work through as we, went along. We didn't really have a COVID model before COVID. But those are some of the ways that we've tried to continue to engage with our families. The virtual technology was really helpful in that our therapists could still, provide services, without being in the home.
Great, thank you. All right, and so if folks have any other questions, please type them in. We have just 2 minutes left, but I have a question for you as the participants. We hope that everyone can take something from one of our webinars and do something with it. We hope everyone can create a wonderful program like those that Nathan and Adrian have talked about. But would you type in the question pod if there's something that you thought of today, like, wait, I'm going to go and do this. If you're going to take one action, would you type that in the questions pod? And then I will be able to share those with others just to help trigger ideas. So again, I hope a few of you at least will do that. While you are doing that, I do want to just, again, thank you for being here. Thank Nathan and Adrian, and let you know that, again, we are here for you at AdoptUSKids. If you have questions about anything, follow up. We will follow up on the things that we talked about that Nathan and Adrian are able to share, we will get those to you, and we will, send you the slides and everything else. But if you need anything from us, Britt put in there, our email is consultation@AdoptUSKids.org. It looks like we have one comment in here. It's a couple comments. So Nicole said it'd be a great idea to check in with families after the adoption. Rosalind said, talk to the post-adoption specialist about services to see if they already have the things discussed in place. And then let's see, somebody talked about creating a resource guide for families and tracking progress with families, the pre and post assessments. Morgan loved that idea. Deirdre asked about presenting individuals with a survey after orientation, in addition to a survey before and after finalization. And Jennifer's going to educate herself more about the services being offered in her community to see that maybe there's not enough in-home services there. And it looks like we have one more question. And I think this Paul is asking this, and we'll ask both Nathan and Adrian. I know Nathan talked about it a little bit. Are you working with other states to help them get on board with your programs? And so let's ask that question first, Adrian, or let's Nathan. I know the answer for you, so why don't you answer that, and we'll have Nathan answer. Adrian answer. Sorry.
Yes. So we started out just in Missouri, and then we of course have started working in Kansas, and then we are working with some other states as we're building our replication efforts and trying to figure out how best to help other states implement it. So we are actively working on that right now.
Yes, and for us, our program, Mary, works statewide throughout the state of Georgia for, those children who are receiving Title 40 or state-funded adoption assistance or guardianship assistance in the state of Georgia. But, we have over the years provided consultation to other states who were, looking to initiate programs like crisis intervention. And, we've been able to provide information on how well the service is working, how, our model is set up, and things like that. Just, pretty much serving as a resource for states who may want to work with the vendor to provide a crisis intervention service model. So not so much that our, vendors will go out of state to work with, our families who are placed out of state, but, more or less a resource for other states who want to start something similar.
Great. And both of you have done a lot today to help with that already. So thank you. And I want to mention just one more thing that Paul mentioned, the TBRI model, which they're using in Utah, and they're certainly using that in many places and have had very good things to say about that. So another model for folks to look at. But again, I just want to thank you both, Nathan and Adrian, for all of the amazing information you shared. Really appreciate your time and appreciate everyone being here today. Please remember to do the evaluation. Let us know what you thought, and reach out to us. Britt put her email in the chat. So if you have questions, reach out to her and let us know what you need from us. And again, thank you, Nathan and Adrian, and thank you to Dallin and Britt behind the scenes doing all the work. And thank you, everyone. Have a great day.
Thank you.
Thank you.